My name's Nicole Bailey Rice. I'm a certified registered nurse anesthetist as well as a psychiatric mental health nurse practitioner, and I've been running Boise Ketamine Clinic here in Boise, Idaho since 2016. Ketamine is classified by the FDA as an anesthetic. It has been in use globally since the 1960s. Ketamine has been used for mental health in this country for around a decade, and it's one of the safest anesthetics we have in existence. It's frequently used in the ERs for children as well as many operating rooms. The way we're utilizing it in clinic is for the treatment of various mental health and pain conditions. An off-label use of ketamine means that when something was first developed, a pharmaceutical company has 7 to 20 years, depending on the type of patent that they have, to add new uses to a medication's label. By the time we knew that ketamine was good for mental health, it had been generic for many decades, so nobody was incentivized to add a new use to an old drug. Ketamine works a variety of different ways. The first way I'm going to talk about is physical healing. As we age and with certain disease processes, we have neurons initially that are nice and tight, but over time they become further and further apart, and some of them eventually die. Ketamine creates a process in your own body that physically heals and repairs these neurons. There's not many medications that do this, and this is very rare. So physical healing is the first. The second way is by balancing neurotransmitters. Ketamine decreases stress neurotransmitters and increases feel-good neurotransmitters like dopamine. The last way ketamine works is by decreasing inflammation in the body. Candidates for ketamine would be people that have tried at least one traditional treatment modality and preferably two. So this can mean a medication like an SSRI or an SNRI or some type of cognitive behavioral therapy. People who still have residual symptoms or anyone who is suicidal would be a candidate for ketamine. If you have a primary care provider or a mental health provider you are already working with, we do prefer a referral. However, if you can't obtain a referral, we do have mental health clinicians available on staff who can help determine if ketamine's a safe fit for you. First steps to get started would be to complete a phone consult with our clinical staff to ensure that ketamine is something you can safely pursue in an office setting, followed by completing our intake process. Once ketamine's determined to be a good fit for you, you'd be welcome to schedule your initial sessions. Our traditional mental health course is done as a series of 6 sessions over about 3 weeks' time. Each one of these sessions is about 90 minutes total appointment length. 40 to 60 minutes of this is the infusion piece, followed by about 30 minutes of recovery time. You will always need a ride home from the clinic, and you should fast 4 hours prior to your sessions. Please continue to take medications as prescribed. Any adjustment to your current medication regimen should be done by your prescribing provider. One of the questions I frequently get is how ketamine feels during sessions. The first 5 to 10 minutes, ketamine can feel very similar to alcohol, feeling a little disinhibited, feeling a little loose. Then it begins to feel similar to nitrous at the dentist, seeing some colors, floating. It can get a bit more somatic from there, with many body sensations coming in. For some people, this feels like floating or sinking or being molded. For other people, it's very visual and can feel a disconnect between brain and body. This is called dissociation, that disconnect between brain and body, and it's what we're doing when we're using a dissociation-based course. Ketamine can get a bit more intense past this experience. You could reach a state of ego dissolution, which for some people can feel like a near-death experience. On the other side of that state is a white, blank rebirth type of feeling. Not everybody gets all the way through this type of feeling, but these are the most common experiences. The way that we track results with a ketamine course is by using clinically validated screeners like a PDQ-9 for depression, a GAD-7 for anxiety, or a PCL-5 for PTSD. We do have several different screeners that we can utilize during your course depending on the reason you're presenting to the clinic. We expect to see around a 50% drop in most of these screeners by the time you finish your series with us. Many patients ask if they can continue to work during their course, and the answer is yes. We just ask that you give your brain and your body some recovery time after your sessions. Typically, 12 hours is recommended before you drive or return to work. Most people maintain ketamine about once a month, depending on the route utilized. For IV maintenance, most patients settle into every 3 to 4 weeks usage. Intramuscular patients tend to settle into every 2 weeks. The amount of ketamine that is bioavailable or usable to your body varies by the route of administration in which it's delivered. Intravenous, which means through an IV in your vein, means your body can absorb every milligram of ketamine that's delivered to you. For example, if I were going to give you 100 milligrams of ketamine through your vein, your body would utilize all 100 milligrams of that ketamine. If I were going to give you the same 100 milligrams of ketamine by a shot or an intramuscular injection, your body would absorb about 90 milligrams of that same 100 milligram dose. If I were going to give you 100 milligrams of ketamine through your nose or through your mouth, your body's going to absorb about 25 milligrams of that same 100 milligrams. So in order of efficacy, ketamine's most effective and most bioavailable through an IV followed by an intramuscular and lastly oral or nasal routes. It doesn't mean that ketamine's going to be most effective by one route or another. It just means you may need to do some dose adjustment. The research that's been done primarily has focused on an intravenous route of administration. We do try to make ketamine something that is both accessible and maintainable for patients that complete a course with us. We have many ways that ketamine can be maintained. If intravenous is something that's not financially feasible for you, an intramuscular course may be a good fit. Intramuscular patients can expect to achieve very close to the same results as intravenous patients. The difference ends up being primarily in the experiential component of ketamine. In order to get the most out of your ketamine course, we recommend that you continue to see your therapist, take your medications as prescribed, treat your body well by getting an adequate amount of rest, and maintain a good diet and adequate nutrition. While ketamine isn't considered a classic psychedelic, it is the only legally available medication that functions similarly to a psychedelic. And while the goal is not a psychedelic experience, there is therapeutic value in that dissociative piece. When using ketamine in a clinical setting prescribed by trained staff, ketamine is considered a legal prescription.